Hello everyone, I'm Al Hassan Lee. I'm from Senegal. I'm a medical student and a member of this course, Policy Advocacy on Genetic and Genomic course 2025. And I have to present on this subject. Should, should African countries adopt genetic passport to tailor public health interventions? As a negative theme, what is genetic passport? It is a digital or physical record of an individual's genetic information used to identify genetic predispositions, risks, and response to treatments. Why opposed to genetic passport in Africa? While promising risk and challenges outweigh the potential benefits for African countries at this stage. And the key message, why genetically advanced genetic passports are not suited to Africa's current realities. And they pose a major ethical risk, significant practical challenges, and could exacerbate existing inequalities. And my position is Africa should prioritize more inclusive and equitable solutions before considering complex technologies like genetic passports. And my argument is based on this point ethical and privacy concerns. Widespread collection of genetic data raises serious privacy risks, as genetic passports could be misused for discrimination, surveillance, or unauthorized access by government or private entities. There is a lack of robust data protection laws in many African countries, increasing the risk of genetic data being exploited by foreign companies or insurers. The risk of genetic discrimination and social inequities. Genetic passport could lead to stigmatization or exclusion of individuals with genetic predisposition to certain disease. Employers, insurance providers, or even governments might deny opportunities based on genetic risk profiles, exacerbating existing inequalities. The following point is high cost and infrastructures challenges. Implementing genetic passport requires advanced infrastructures, trained personnel, and significant investment, which many African countries cannot afford at this stage. Many healthcare systems in Africa lack basic healthcare access, so investing in genetic passport might divert resources from more pressing health priorities like maternal health, infectious disease, and malnutrition. And the following point is the potential for misuse and policy challenges. Government could use passport for non-medical purposes, such as population control, political operations, or restriction migration. There is no global regulatory framework ensuring ethical use, making African nations vulnerable to exploitative partnerships with biotech corporations. And the last point is a limited scientific consensus on effectiveness. While genetic information is valuable, it is not sole determinant of health. Environmental, social, and lifestyle factors play a significant role in disease development. Relying too much on genetic passport might oversimplify complex health challenges and neglect broader public health interventions such as sanitation, education, and nutrition programs. And the immediate priorities for Africa is the public health needs. And the lack of preparedness is the absence of infrastructures and robust legal frameworks to protect genetic data. And the risk of exclusions, rural and marginalized population could be left behind. And the alternative I propose is to strengthen the healthcare systems, invest in primary healthcare like vaccination and disease preventions, and the education and awareness, educate the public about genetic without relying on genetic passport, and on the ethical and legal frameworks, develop robust law before considering genetic technologies, and targeted program use genetic testing for specific disease like sickle cell disease rather than generalized genetic passport. And the final message is genetic passports are premature for Africa. They present ethical risk, practical challenges, and could worsen inequalities. And I call African countries to prioritize inclusive, equitable, and locally adapted solutions, strengthen the healthcare systems and ethical frameworks before considering complex technologies. Thank you for your attention.